trauma to the patient. So it's a big surgery that causes quite a bit of tissue injury and results then in has to require a lot of healing afterwards. You also pretty much lose 50% of your lung function in this context. And it's also important to know that as we all go through life, we acquire lung diseases that affect our lungs. And so if I say 50% of your lung function, you're basically left with the other half of your lung, and that may be affected by a different disease. For instance, some patients smoked during their use, and they may have COPD or emphysema, which may affect the other lung. So it may not be exactly 50% of the ideal lung function. So it really drops your lung function quite a bit and causes, in that context, your functional status to potentially deteriorate, and in some situations, patients to be left with a functional status that would be very difficult to maintain their quality of life and potentially require oxygen. And obviously that's one of the things that we try to avoid by selecting patients appropriately when we decide